right now, without you even thinking about it, your body is doing like millions of things. I mean, your heart is beating, your blood pressure is adjusting literally second by second, your stomach is digesting food, your body temperature is staying steady, your nervous system is working to keep that body temperature steady. All of this happens automatically thanks to a part of our nervous system. And you may have never heard about this. By the way, write in the comments if you know about the autonomic nervous system. This is the part of the nervous system that does this stuff. But what we're talking about today is dysautonomia. What happens when the autonomic nervous system doesn't work properly? And it affects lots of people. So we're actually going to talk about this. And one of the things that actually made me want to do a video on this is more recently, I had a patient bring this up in the office. And I was like, this is a really, really great topic to discuss because I know people are talking about it online. By the way, write in the comments if you have dysautonomia, if you've dealt with it before, if you know what's going on. I want to know. So dysautonomia is really a general term for a group of conditions where the autonomic nervous system really doesn't function the way it should. So think about the autonomic nervous system as your body's like autopilot. It's got two branches, okay? It's got the sympathetic nervous system, which kind of gets things revved up, raises your heart rate when you're scared or startled. And then we also got the parasympathetic nervous system, which kind of calms things down. Like it slows down our heart rate, for example, when we're resting, okay? So you can see sympathetic, parasympathetic. We got these two sort of different branches. Now, when these two different sides are in balance, well, I mean, we're talking yay, everything's running smoothly. But in dysautonomia, the balance is disrupted. And the result is that there can be symptoms that literally affect almost every part of your body, from your heart and your blood pressure, to your digestion, to your bladder, even your ability to sweat. So you're probably saying, well, why does this happen? It actually can happen for many different reasons. There are primary causes and secondary causes of dysautonomia. And we start out with primary dysautonomia. That means that the autonomic nervous system in and of itself is the problem. Okay, so what are some conditions where this applies? This would be like POTS, postural orthostatic tachycardic syndrome. By the way, I have a whole video on this, so if you're watching on YouTube, I'll link that here. This is where your heart rate sort of spikes excessively when you stand up. It also includes pure autonomic failure and multiple system atrophy, which are rarer and more progressive conditions. There are others as well. Now, when we talk about secondary dysautonomia, this means that there's another disease or condition that's damaging the autonomic nerves. The most common culprit is probably diabetes, which, by the way, so many people have diabetes. Over time, diabetes can injure the small nerve fibers that control autonomic functions, okay? But there are other causes as well, things like, autoimmune diseases such as lupus or Sjogren's syndrome. Vitamin deficiencies can also play a role in autonomic issues. Parkinson's disease, infections, there's other things as well. In fact, many people develop and did develop dysautonomia symptoms after COVID-19, okay? So we often think about long COVID symptoms, etc. So I think this is really important to mention. So what's the deal? Like, what's going on inside your body? Well, basically, like if you're in a healthy person, okay, when you stand up from a chair, your autonomic nervous system instantly sends signals to like the parts of the body, the brain, etc., to tighten your blood vessels and slightly increase your heart rate. What that does is it keeps blood flowing to your brain so that when you stand up, you don't feel dizzy. I mean, really, the body is amazing, guys, because honestly, everything we do, our body is working to make sure that we are okay and feeling good for the most part. In somebody with dysautonomia, those signals are either too weak, they're too slow, they're absent, they're not functioning right. Blood can pool in the legs instead. The blood pressure can drop. The heart may race to compensate. And that's sometimes why people with dysautonomia might get dizziness or lightheadedness or even fainting with standing up and other things. It goes beyond just standing up. It's not just that, though. The autonomic nervous system, remember, it controls so many things. Digestion. So some people may experience like nausea or bloating or constipation. It controls sweating. So some people with dysautonomia have issues with sweating. It can affect the bladder, it can affect your ability to think clearly. So many things can be affected and often are when we deal with dysautonomia. So this is the thing, there's no single cure for dysautonomia, but there are effective ways at managing it. And I always say, you kind of want to get to the root of the problem. Doctors, we physicians have always been getting to the root of the problem, but that's the deal. You want to start with where it's starting, what some of the issues are. So I want you to see your doctors, see your specialists, your cardiologists, etc. Many treatments deal with lifestyle changes, making sure that you're staying hydrated, drinking fluids. In some people, they may need to increase their salt intake. Some people may need to wear compression garments in the legs, the abdomen. Sometimes people are prescribed a specific exercise program, okay, like a graded sort of exercise program. There's a number of things that can be done, okay? Now, there are also other things besides lifestyle changes that may be employed here. There are medications that may help some people. Medications such as beta blockers may help. Midodrine may help. So beta blockers may help with like racing heart rate. Midodrine may help with like a low blood pressure. Sometimes people may need other medications to help with fluid balance. There's a whole bunch of stuff that's available, okay? The medication, and if you need a medication, really depends on what's going on with you, your underlying conditions, like all the things, okay? So this is not something where you can just pick out a couple symptoms and say, aha, I think that's me. I mean, I think it's good to think it's you, but you got to go through the proper workup. Cardiologist, maybe a neurologist, and other specialists, your family doctor, internist, etc., to see what's going on. The most important thing to understand is that treatment is and tends to be highly personalized. Also, symptoms can be highly personalized as well. You know, what happens with one person is not necessarily what happens with another. So I want you to be patient. You know, dysautonomia can be frustrating. I understand that. But you want to work closely with your doctors. Make sure you find doctors that you really can talk to, that you feel comfortable with. This is really what's helpful. I want you to feel hopeful. I want you to feel like you can live a full life with dysautonomia. But it's going to take a little bit of work, which if you're watching this video and you're familiar with it, I know that you already know that, but I do want you to be hopeful, okay? So remember, getting to sort of the root cause, that the type of dysautonomia is going to be very important for you. Follow up with your doctors, make sure you're seeing everybody like you should. That will help. Just know that your symptoms are real and you should never, ever, ever be sort of shushed or blown off. I think it's always important to know that you and how you feel is very important and it's valid. So write in the comments, let me know what you think. I hope this video was helpful. Let me know. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Please subscribe to my channel. Follow my page on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp, all the things. All right, guys. Also, sign up for my free health newsletter at drjencaudle.com.